So good morning, colleagues, ladies and gentlemen. Welcome to my presentation. My name is Johnoson Anyona. I'm a supply chain advisor working for InSupply Health. InSupply Health is a health advisory firm based in East Africa, and we specialize in providing technical assistance on supply chain at all levels of the health system. In this presentation, I'm going to spotlight one of our service offerings called the Impact Teams, and you're most welcome. So as a background, just like to pose a hypothetical question on why is data availability not enough? So significant investments have been made in building and automating information systems across the world, that is health management information systems and logistics management information systems. Data continues to guide strategic development of health supply chain in sub-Saharan Africa. Yet, in fact, we do realize that data availability alone is not enough to strengthen service delivery or commodity availability. So the key thing, apart from making sure you have data available, is to creating a data use culture to be able to make sense of the data and use that data for decision making to improve the performance of your program. So what is the impact team approach? The impact team approach places people, data, and processes at the heart of supply chain improvement. And impact stands for information mobilized for performance analysis and continuous transformation. So impact teams, simply put, are multidisciplinary quality improvement teams that have a common goal of improving supply chain performance. The teams usually meet regularly and use that quality improvement approach to first look at the data, make sense of it, then prioritize what the problems that are emerging and propose solutions that they're going to take and ultimately move forward with implementing the solutions in terms of the actions. So these impact team members are trained to develop, interpret, and set their performance targets for supply chain KPIs. And they're encouraged to follow a structured problem-solving approach and empowered to use their data for decision-making. So the cycle you are seeing on the right is the process that impact teams follow, where they begin with analysis of the performance, identifying priority problems, conducting a root cause analysis, identifying what actions they need to take, then moving forward with the implementation. And that cycle continues. So it is summarized in form of review, innovate, do. So where have we implemented the impact team approach in Kenya? So between 2019 and 2021, InSupply Health implemented the impact team approach in a total of 59 sub-counties across 9 counties. And you can see the map. So the counties shaded red are the areas where we've implemented. These are Nairobi, Nyeri, Mombasa, Trans Nzoia, Siaya, Samburu, Wajir, Mandera, and Turkana. So what makes impact teams unique from other data review teams? We realize that there are many data review teams existing at county, at sub-county level. So the unique feature of these impact teams is from the start, where they are deliberately designed to be multidisciplinary. So at the point of forming the team, you have to make sure you have a good mix of skills and competencies that are desirable. And this include things like supply chain skills, data extraction, analysis and visualization, organization skills, problem solving skills, and of course, leadership. So having that multidisciplinary team from the onset and having a common goal, which you set, and linking it to existing structures within the health system. Second unique feature is the use of decision support tools. So one of the examples of the decision support tools which we deployed is a dashboard called the indicator tracking tool that extracts logistics data from KHIS, the Health Information System for Kenya, to make it user-friendly and easy to interpret for the impact team members, because data visualization is key in terms of helping the team to navigate and interpret the problems that are emerging for their decision making. So other examples of decision support tools include a structured agenda, an action plan template, and documentation of the minutes after the meetings that they hold. And another unique feature is now following a structured process. I know we have been at one point in our lives attended a meeting that you don't know what the agenda is. There is really no direction or outcomes that you're expected to achieve. So following that structured process has really been an effective tool in making the data review teams called impact teams effective. So the teams are empowered with the skills to be able to analyze and use the data for decision making and follow a structured format in their meetings to make sure that there is the notes are taken down. They start with reviewing the previous minutes, the action plans and the status, go to the current performance, and ultimately conclude with having a new action plan on the actions that they're going to take. Then another success factor for impact teams has been consistency. We realize that data changes every day, every minute. So if you review data today and you look at your performance and take maybe 4 months before you look at it again, a lot of things would have changed. So consistently reviewing the performance has been a key to the success. And for the impact teams, they have been meeting monthly. Finally, another unique feature that has been a success factor has been having the leadership support and commitment. So at sub-county level, that means the sub-county MOH, and at county level, that means the CHMT. And once this whole process is successful, then looking at now institutionalizing in the health structure so that it's a best practice that is adopted by all and every data review team. So at this point, as I highlighted, we have implemented in a number of counties, and the next few slides, I'm just going to spotlight one of the counties, that is Nyeri County, where we implemented the impact team approach, to hear firsthand from one of our impact team champions on what the experience has been with the impact team approach. So in the next couple of slides, you'll be hearing the voice of Dr. Stephen Washira, who is the sub-county pharmacist at Nyeri South Sub-County, who has been supporting supply chain commodity management and reporting in his sub-county. So the audio is a recording of interviews we conducted with a number of impact team members last year on what their experience has been.
For the first time, I've seen a plan that is really working well. As we began this project in October of 2019, definitely the reporting rates for the facilities were quite low, and we couldn't be able to know what was going on in the facilities because there were so many discrepancies from the beginning balance and the ending balances. But when the impact team came up, we were now able to do the follow-up to know when commodities are moving from one facility to another facility in the sub-county level, to explain how patient numbers are being affected with the commodities that for the family planning and also for the vaccines. So the impact team has really made a big impact. From the beginning, we were around 90% in the timeliness of reporting, but the problem was not even the timeliness of reporting. The data quality was the biggest issue. Now we have seen a total change. Even the ones who are now providing us with the report are starting to own the information that they are providing in the reports, because they know we have to question on the beginning balances and the ending balances. One interesting part is we never interacted to a personal level with someone like the one who is in charge of the records, because we can even be able to scrutinize the information that we are provided together with the person. We also have various individuals, the ones from high volume facilities. We have one incorporated into our group, so we can be able to monitor and see the differences in the consumption of commodities from the large host facilities and even the dispensaries and health centers. So it has made us be able to come together and form a team in such a way that right now everyone knows what is going on in the impact team when it comes to the concerns of family planning commodities and when it comes to vaccines. We never used to know the various differences. Even if we had those meetings, we never got to a point where we would be able to analyze the data specifically for the vaccines and for the pentas, which right now is coming out so clear. The most enjoyable part basically is the interaction between the in-supply individuals together with the impact team. We have learned so much in the process. For the learning packages, I'm planning to finish all of them because I know I can put them into practice in real life. Now, from not just supplies of commodities, I can do it even in my individual life, organize myself. So these packages are also a very important thing that I've come to realize. We are so grateful for whatever In Supply has done for us. To even be able to organize those virtual meetings by ourselves. Even if we get the support from the county, we will be very grateful about it. So thank you.
Okay, so right there you had one of the experiences from one of our impact team champions, Dr. Stephen Washira, sub-county pharmacist from Nyeri South, describing what his experience has been during the implementation of impact teams in Nyeri. So the next couple of slides, we've had now the qualitative side of things. So now I'm switching gears to quantitative review. So we did an evaluation of the supply chain performance of the impact team counties, and just to assess whether there was impact, compared them with the performance of similar indicators for the non-impact counties to assess whether there was any impact on the work that we did. So as mentioned, the comparison was between impact and non-impact counties, and the criteria we used in matching which counties to match with were the population of these counties, the women of reproductive age, the socio-economic livelihood, the geographic characteristics, as well as religious and cultural factors. So for instance, Garissa, which is a non-impact county, is a good match that can be easily compared with Mandera, that is not Mandera, which is one of our impact counties. So these are the results of that evaluation. The first indicator was on reporting rates and timeliness, where we realized that the impact team counties saw a faster rate of increase and an overall higher reporting rates. So the impact team counties demonstrated higher reporting rates across all the years of evaluation between 2019 and 2021 compared to the comparison counties. So what you're seeing here are the bars representing the various years, 19, 2020, 2021. So these are the impact counties and these are the non-impact counties. So there was a faster rate of increase in reporting rates for the impact counties. There was also similar trends observed for on-time reporting, that is timeliness, where impact team counties saw a higher reporting rate than the comparison counties in 2019, and increased reporting rates by 10% compared to 9% in non-impact counties. The next indicator is stock status, or stocked according to plan, more precisely. So this indicator assesses whether the facilities in a given county, in a given sub-county, are adequately stocked. So what we saw is that impact team counties almost consistently demonstrated 2% or more in terms of the total number of facilities which are adequately stocked. And the rates of change over time between the impact counties and the comparison counties is relatively similar, ranging between 1 and 3%. So overall, impact team counties were more adequately stocked for all the family planning methods, with the exception of one road implants, which during that period had a global supply challenge. So that was really out of the control of anyone in the teams. The third indicator is on quality of reporting. We realized that the quality of reporting also improved more for the impact counties. So one indicator that we usually track is called the absolute percentage difference between the ending balance of the previous month and the beginning balance of the current month. So for COCs and injectables, we noticed dips, then an increase for both impact and non-impact counties. However, for emergency contraceptive pills and implants, we saw consistent increase for impact counties between the period of in the period of review. The percent of facilities that had a desirable difference, which should be 10% or less between the ending and beginning balance, also improved across the years within the impact counties.
Doc, your 5 minutes, please.
Very good. That is more than enough.
Oh, great. Thanks.
So those are the quantitative and qualitative results of our implementation. So in conclusion, what are we saying is that data visibility and data use culture are both critical, equally important to building responsive and resilient supply chains. As I mentioned at the beginning, it's not just enough to have good reporting rates or having available data, but now what do you do with that data that is reported by the facilities? You need to digest it, utilize it, and have it inform your decisions. Then, as we heard from Dr. Wachira from his experience, which he shared, that beyond improving supply chain performance, which is the obvious expected outcome, the impact teams also are able to foster team cohesion, coordination, and collaboration across programs. And we mentioned this at the initial stage of bringing the team, forming the team, where you need a multidisciplinary team, and they're able to work together in their data review meetings. So the key secret to success for the impact teams is having a shared common performance goal, following a structured problem-solving approach, making use of decision support tools that I highlighted, like dashboards, like the action planning templates, the minutes, etc. Then having good composition, people with skills that are desirable, supply chain data analytics, visualization, coordination skills within your team, meeting consistently, having leadership commitment, and then when the performance improve, to motivate the team, rewarding good performance. So I have come to the end of my presentation. In case you need more information on the impact team approach, please feel free to reach out via email or get in touch with, contact our website, which I have listed there on the slide. Thank you very much. Back to you, Dr. Ari.